Hi, my name is Rachel Brackey Holman, and I'm one of the physicians here at the CU Sports Medicine and Performance Center. I am also the medical director here, and I wanted to record this message to give you some updates about our center and to provide you some important information so that you know so that you better understand what we're doing during this COVID period of time. First of all, before I launch into what we're doing, I want to say that we miss you and we hope that you are all doing well. Do know that we are still open for business and we'll get into the details of that. But please reach out to us if you're having any problems or if you have any concerns or questions. We have our phones being staffed every day, Monday through Friday, 8 to 5. So just remember that. But getting a little bit more into detail, as I'm sure you all are aware, most places have responded and had to change due to COVID. And the reason we all did this is to protect everyone, our patients and our staff and the people who work here. But we also recognize we have a responsibility to our community. And we, for that reason, have remained open, but in a limited way. Our clinic, currently we have between 1 to 2 doctors who come in Monday through Friday between the hours of 8 and 12. And the reason for their visits is pretty limited to urgent or post-surgical cases that need to be seen in a timely manner. Most cases that we're seeing right now, we are converting to telehealth. Telehealth is a pretty exciting platform that is new to most of us, but is something that we got up and running within days of COVID hitting, and we've been very pleasantly surprised with how effective a visit through telehealth can be. This includes for new patients as well. For most people, the doctors and the APPs, the PAs and nurse practitioners, are assessing people through telehealth before deciding if they need to come into clinic. And that's simply to ensure that we're being safe and following the guidelines that have been recommended to us. When we're in clinic, we are wearing masks. Everyone in the clinic is wearing a mask. I took mine off for this video, but as I saw patients today, I was wearing a mask. We also ask that our patients wear masks. And something to keep in mind if you come in for a clinic visit is that you need to come in alone, no children and no visitors. We are really trying to keep the number of people in our clinic down to a minimum. Once you arrive here, we will quickly room you into a room so you're not waiting in a waiting room with a lot of other people. And then we are assessing you as quickly as we can and minimizing the amount of contact you have with any of our staff. From there, I wanted to talk about different departments and what we're doing. So I already touched on the doctors. We're doing a lot of telehealth. And most of us are doing telehealth from our homes. We do have another video that talks about what you can do to be ready for your telehealth visit, so please reference our video library and you can find that there. If telehealth is not an option for you, we can also do telehealth through a telephone. So don't feel intimidated if you don't have a computer or a screen or a camera. We can still provide excellent care via telephone, and I've actually been very pleasantly surprised with the effectiveness of a telephone call as well. It's not only just us doctors working in this clinic. As you know, we have a very large PT group. The PT group has also adopted telehealth and is doing a number of visits via telehealth as well. We do have a number of PTs coming in for limited hours into our clinic. And the visits for those are reserved, again, for a little bit more urgent post-operative type cases, again, ensuring safety and trying to minimize risk to everyone. Our sports performance department is still very actively working, but they are working remotely and they are not in the center. They have discounted pricing for their services, and I would encourage you to look at our website for further information about this. This is a great opportunity to access these resources and to look into those issues if that's something that you've been thinking about doing. I wanted to quickly touch on radiology and x-ray. That is usually a big part of a sports medicine visit, especially for the new patients, but including for follow-ups, especially for post-operative or fracture care. We are still doing x-rays at our center. The preferred method of doing an x-ray is, if a doctor or a provider feels that you need an x-ray, we will let our staff know. And we have a schedule on Fridays between 8 and noon where we give 20-minute appointments to each of the x-ray patients so that you have a designated time to come in and you know that x-ray will be available and quick and you don't have to wait. X-ray is available Monday through Friday, 8 to 12, but we do have other patients in the center. It's safest if you get on a Friday schedule, but if that's impossible for you, if you could coordinate with the pod staff or some of the staff in our center, we can maybe find another time for you. There certainly are other slots. Sometimes we will do x-ray before a visit. Sometimes we will do x-ray after a visit. And in many cases, we don't need an x-ray. But we just wanted to make you aware that that is still an option. Similar for x-ray, we also do have MRI capability. We are limiting our MRI hours quite a bit compared to before COVID, again, for safety reasons. So if your provider feels that there's an urgent need for an MRI, and usually that's because of very concerning findings or extreme pain, we will talk to you about the process for getting an MRI. Most MRIs are being rescheduled into a slot when we reopen more normally, but we wanted to make you aware that those two imaging options are available at our center. So anyways, I hope this helps give you an update about what we're doing here at our Sports Medicine Clinic. We are looking forward to opening up in a broader way. We don't know the details of that. We're really waiting for guidance from the government and from our leadership at CU Medicine and Boulder Community Hospital to make those decisions. We are ready to pivot as needed in any way possible, but I did want to make sure that you had this message that we are open, we are still seeing patients, and we are all very available when it comes to telehealth. So please don't remember that, and please don't be shy about reaching out. Thank you so much, and you guys take care.